Here we are again, folks. It's me, Patrick Galliano, your candidate for presidency for 2016. Hey, let's talk about health insurance. Okay, here's a big topic that everyone feels that, oh, we got it covered now. There's no reason to talk about this anymore. Obamacare is the answer. No, it's not. Obamacare is actually a brilliant idea, looked great on paper, but was poorly executed by our government. The thing about Obamacare that I feel is wrong is I already know somebody that's been on it for a short time, and their premium, after being on it for only, I think, 5 months now, their premium has doubled. Okay? So there's a problem with that process. Here's the other problem. We have the man who's barely making it income wise paying a very, very small premium, which justifiably so. But then we have the rich guy or the small business owner who's paying up to $2,000, $3,000, $4,000 a month for insurance, for health insurance. I know a couple here in Monroe, Wisconsin. It's just them, the husband and the wife, paying almost $2,000 a month for health insurance, and they hardly ever go to the doctor. Here's my problem with that. Where is all that money going for the premium? Well, basically, what I feel is happening here is that insurance companies are just bulking out billions of dollars in profits because if you're paying that high of a premium or even higher in many situations and you're not using it, guess what? That money's going somewhere. Okay? Here's my point. If you're paying $2,000 a month for a medical premium, and let's say after 2 years, you go to the doctor and your doctor's visit is $300. Well, let's say they throw in a few x-rays, so it's about $600. Okay, well, you've already paid all this money to the insurance company for 2 years, but yet you still have a 80/20 copay or you see where I'm coming from, folks? It's not really a good system to use. I believe healthcare should be the same for everybody. Just because you're a wealthy person, I don't believe you should be penalized to pay higher health care. Here's my reason why on that. If you're a millionaire in this country, you're already paying 40% plus on your taxes. Well, now we're going to penalize you again, folks, for health insurance. I think we need to take a closer look at Canada's health insurance program. I'm not saying their health insurance program is perfect, but Obamacare is not perfect. And it's not a disrespect to the president, it's just a bottom line. It is not perfect. Yes, there were millions of people, however many, 6, 7 million of millions of American citizens who were able to get health insurance with the Obamacare program. And that's great. They're paying $15, $20 a month. That is totally awesome. But the problem is it needs to be fair for each and every individual family. Just because you have a small business and you're making $250,000 a year, I do not believe that your premium should be any higher than the guy who's making 18 to 25,000 a year. Now, again, some of you may disagree with that and say, "Well, that's not fair." Well, let's think about this for a minute. What I said in the very beginning when I made my speech that I was running for president, I said I wanted to represent everybody fairly. Okay? We have to keep it fair for every United States citizen. Do we penalize our citizens for living the American dream by making them pay higher taxes? Okay, maybe that's so. But now we're going to add the medical insurance on there. What's next, folks? I mean, what next are we going to be charged for? Let's think about that for a minute when we think about insurance. Also, in regards to insurance, doctors. Now, some of you may believe that all doctors are millionaires and whatnot, but here's the bottom line. I think it's unfortunate that we live in a society, in a country, where a doctor who accepts Medicare has to wait a month, 2 months, up to 6 months to receive their payment from Medicare. I don't care who you are, what kind of business you're in. If you're waiting that long to receive payment for services, it'd be like owning a grocery store and the people telling you, well, I'll be back in 90 days to pay for my groceries. You wouldn't be in business very long. That's not fair either. There's a lot of different things with medical insurance and with the way we do things in this country regarding reimbursement to hospitals, reimbursement to doctors, but most importantly, keeping the citizens' financial burden for medical expenses to a minimum. Okay, and I understand medical technology, everything's expensive nowadays. I get that. MRIs are $7,000 a pop. I get that. Okay, that's not what I'm arguing about. What I am arguing about is where does the the guy who's paying $2,000, where does his insurance benefits kick in the same as the other guy paying 25? And we have to look at that, folks, because here's what's going to happen if we don't. Over the years, people are still going to acquire many, many bills from doctors, hospitals, and then your bankruptcy rates are going to go up because people aren't going to be able to afford the medical bills, regardless of the insurance. And we still have millions of people that don't have medical insurance. And I think that's wrong. And then what a lot of companies are now doing is they're turning the cost of their insurance premiums over to the employees and paying them $7.50 an hour. We can't do that, folks. We cannot have a healthy America getting the proper medical treatment, because what's going to happen is those people making $7.50 are going to say, I decline at this time. Now, obviously, Obama passed a bill where if you don't have medical insurance, you're penalized when you file your taxes. In my opinion, that's unconstitutional. I think a person has a right, even though I don't think a person has a right to take advantage of it and not pay their bill. I'm not saying that. Please hear me out. I just think it's wrong that we make laws mandatory that contradict our very Constitution. And this is not the only law that is like that. And I think we need to take a closer look at that. Again, I would be willing to sit down with both parties of Congress, meet with them on a weekly basis, and let's just come up with something, a plan that's going to work for every American citizen. The other thing is I think we need to eliminate some people who are taking advantage of situations, especially in the state insurance programs such as Medicaid. I believe we have some people that have just taken advantage of situations. And we got to stop that, ladies and gentlemen. We got people that are doing things unethically, that are on government benefits through the state. And I think that we need to get a better approach of that. I believe children should be automatically covered, regardless. Parents, I believe, if they're using the system properly, that's one thing. But when they're abusing the system, and what I mean by that, when you have somebody who's working a job, being paid under the table, not claiming that income, but then getting free health insurance from the state, that's a problem. And I think we need to get a little bit tougher with those types of things to keep the medical insurance costs down for everybody, and also keep medical costs down for everybody. You get rid of the fraud and you lower the bills. It's a no-brainer, folks. So vote for me in November of 2016, folks. I guarantee you I will make it a very good effort to get with Congress, and let's get this thing done, and let's get it done right this time. And no, it won't be called Galliano Care or Patrick Care or anything like that. It'll be called basically AmeriCare. If you want to know the truth, it should cover everybody. So once again, thank you for your time. Please vote for me November 2016. God bless you, and God bless the United States of America.